To talk about Malasana, that is the garland pose. To do this pose, follow the following steps. Stand with feet slightly wider than the hip width. Toes turn out to 45 degrees. Bring your palms together at the chest in Anjali Mudra or the prayer position. Inhale, and as you exhale, bend the knees and slowly lower into deep squat. Keep the heels on the floor if possible. If not, place a folded blanket under your heels. Press the elbows gently against your knees to help the hips open wide. Keep the spine long and chest wide. Do not round the back. Hold for 20 to 30 seconds, breathing deeply and slowly rise back up. So what are the benefits? Squatting compresses the abdomen and stimulates the entire digestive tract. It improves blood flow to kidney and urinary system. It improves hip flexibility. It opens up your tight hips and groins and reduces the lower back strain. It strengthens your pelvic floor muscles. It improves the flexibility and strength in the ankle and knee joints. It improves your overall well-being. It grounds the body and calms the nervous system effectively. Next is Vajrasana, also known as a thunderbolt pose. To do this asana, follow the following steps. Kneel on the mat. Bring your knees and feet together. Sit back on your heels so that the buttock rests on the heels and thighs on the calves. Place your hands on your thighs, palms facing upwards. Keep your spine erect, chest open and shoulder relaxed, gazed forward. Breathe deeply and naturally in this position, maintaining stillness. This is the only yoga pose that can be performed immediately after eating. Hold for 5 to 10 minutes and gradually increase the duration depending upon your practice. So what are the benefits of Vajrasana? It diverts blood flow to the digestive system and improves digestion. It stimulates pancreas. The pressure on the legs redirects the blood to the abdominal organs. Its regular practice helps in controlling the post-meal blood sugar. It improves circulation to the kidneys and urinary tract. It maintains lumbar curvature and strengthens the back muscles, promotes mindfulness and improves stress-related cortisol levels. To perform this pose, follow the following steps. Lie on your stomach, feet together, palms flat on the floor under your shoulders. Keep elbows close to the body. Forehead resting on the mat to start. Inhale slowly and press your palms on the floor to lift your head and chest up. Roll the shoulders back and down to open up your chest. Keep the lower body from the navel down grounded at your floor. Hold the pose, breathing deeply, maintaining a comfortable back bend. Exhale and slowly lower the chest down. Hold for 20 to 30 seconds. Bhujangasana strengthens the spine, opens the heart, stimulates abdominal organs including pancreas and can aid blood sugar regulation, making it beneficial for diabetes. It massages the pancreas, increasing the insulin secretion and controlling glucose. It improves the chest and improves cardiac circulation. It tones spinal muscles and improves back pain, promotes deep breathing and improves oxygen uptake. It releases tension held in the chest and abdomen. It energizes the body and improves mood through cortisol regulation.